Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Alright, Derek, tell me what's going on with your hamstring and your back.
I've had issues in my hamstrings for a couple of years now.
Okay.
So it's every time I go for long runs, they just tend to cramp up, spasm. They fatigue easily.
The right
hamstring
hamstring
gets heavy.
Okay. So how did you injure it? Like, what did you do?
I've noticed it when I did speed workouts. It just like I felt a snap in the muscle, and I just...
So you strained it?
Strained it.
Okay. How long has it been going on?
On and off for a couple of years now. I would say the last 6-7 years.
Okay. So what symptoms, what other body part that involved with that?
I also had it in my calves.
Both of them, or
both calves?
Both calves. Okay.
So same exact mechanism. They high intensity running would just make it like tight and snap.
Okay. So what's difficult for you to do? Sitting, standing, walking, transfer, gait, or
with regards to the hamstring.
Hamstring and the back too.
The back issue that I have is more from sitting, like prolonged sitting.
Is it happen? Did that happen at the same time with your hamstring?
Now this developed, I think, in the last maybe 6 months.
6 months. Yeah. Okay. And did you have any injury or just over time?
With the back, I don't really remember anything.
Okay. So how we aggravate your back and your hamstring symptoms?
The back is more aggravated when I sit like at a 90-degree angle.
Okay.
You know, if
so like this.
Yeah. So that I really feel it, and then
how much from
the longer I sit, it can go as high as maybe 7.
Okay.
7 or 8, but you know, then I stand up to kind of relieve it.
What about the hamstring?
The hamstring is relieved by just, if I'm running, then I have to walk.
Okay, so you will
have to
not
slow
be able
down.
to slow down.
So if I keep running, then it just gets heavier and heavier, and you know, I can feel it's going to cramp up eventually.
Okay, so that's your hamstring.
Yeah.
So, do you have any limitation on the range of motion, or the range of motion is okay? It's just
I feel I don't have the flexibility in the hamstrings, even the calf, I think.
Okay. So we'll have you actually stand up. We're gonna like just check your range of motion. So I want you to actually go down as far as you can, and let me know where you feel the tightness. Forward. Marking your legs, like touch your legs. So it's above your.
So right there, I feel the hamstring tightness.
The hamstring. Okay. So that's really tight, because we're gonna measure it. Like, we're gonna do the same motion after the treatment, and we'll see how far you can go down. Mark it in your legs. Extend. That's not bad, actually. Rotate left and right. Okay, side bend.
If I went any further to the right, I felt like it was starting to cramp up.
Okay, so let me know what aggravated, okay? So let's do side bend, left and right. It's tight a little bit, okay? The other side. How's that?
Just some pulling on the right side.
So tightness. So your limitation most likely flexion, forward flexion. Okay. So let's have you have a seat, and you said with resistance you can feel the hamstring.
Yeah.
So I want you to let me know how much do you feel in your hamstring while I'm resisting it.
Okay.
So what kind of treatment you had for this before?
Well, I would say like 5, 6, maybe even 7 years ago, I've had several physical therapy treatments. You know, I've had deep massage, I've had acupuncture. I had so many different
things. Yeah.
Things,
Yeah.
But
Okay.
they just keep coming back. I just felt like heaviness in the calf.
How much from 0 to 10?
5.
5. Okay, let's do the other side.
It's less, maybe just a 2.
2. So
Heaviness.
both calves are tight, but it's more tight
More on
on
the
the
left. No.
And your hamstring, where do you feel it usually? Upper, mid, lower?
More middle,
Here.
like in the belly,
Medial or
like the
lower?
muscle belly,
Muscle belly. Okay.
like right there.
Is that too much?
No. So when you find a painful area, you don't want to really push on it then.
Yep. So if you have localized inflammation, you don't want to rub it to inflame it more.
Okay.
Does that make sense?
Yes.
Because if you don't have inflammation, do you feel pain with this?
Only a little bit.
Here?
No.
None.
Yeah.
Because there's no inflammation here. And that's the same exact pressure. What the difference between here and here? It's the inflammation. So one of the signs of inflammation is the patient very sensitive to touch in that area. To regular scar tissue. Do you feel that?
Yeah.
You feel that grinding?
Yes.
That's a scar tissue. But make sure it's not painful. Relax.
Okay.
How's that?
It's okay.
You know if that's too much. Okay. How's that feel? Any pain, discomfort?
A little bit pain.
What about now?
Less.
Make sure
Mm,
grinding
a little
here.
bit.
It's not too bad as your hamstring or the back, but you feel that, yeah. Is that painful, tender, or is it
Pressure.
pressure? Okay. That's really... So let's actually have you bend forward and just mark on your leg how far you can go down. Mark on your legs. Look at that.
Yeah. Wow.
How many inches down now?
Let's say good 4 or 5 inches.
So you gained 4 or 5 inches. You were able to touch the floor ever?
When I was younger.
When I was younger, okay. So that was like a few years ago.
I wish.
Do the flexion and tell me how that feels. How's that?
It's a little better.
You're maintaining that range of motion.
Yes.
You know, if you still feel a little bit tightness at the end, you know, that's just a little bit inflammation there. But we almost having the 4 inch of motion now. You're touching your toes, which is not bad. So that's look like a 5 inches. You gained 5 inches, yeah?
Yeah.
Yeah, that's beautiful. Let's do the heel raises.
Better.
Any pain or it's gone?
It's almost gone.
Okay, awesome. Yeah, so what do you think about ASTR treatment? You're a physical therapist, so you had it on yourself.
You know, I've never had this much relief in one session like this. So I think ASTR is great.
Awesome. You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.